So my name is Kyla Ehrenreich, and I'm a physician assistant at the Petaluma Health Center, which is a community health center in Petaluma. And I am a family medicine practitioner, and I specialize in pediatric wellness. And I am not a seasoned presenter. This is one of my first public presentations, so forgive me if I seem a little nervous. Work with me. I'm glad it's a small audience. So when I was asked to talk at a sustainability conference, I was really excited. I was like, I love sustainability. You know, I drive a Prius, I grow my own veggies, I am from Vermont, I live in Sebastopol, so I was like, of course. But as I started looking into the definition of sustainability, and particularly how it applies to healthcare system and the health of individuals, I honestly got a little disgruntled. I really realized that the healthcare system is not all that sustainable, nor is the health of individuals in general in the United States. So I looked into it a little bit more and really realized that for a long time we've been really reliant on reactive medicine and not preventive medicine. And thankfully, at the Petaluma Health Center, that's really what we're trying to do, is we're really trying to promote prevention. And that's what I'm going to be talking about a little bit today. I'm going to be talking about the impact of chronic diseases on the healthcare system, and then I'll be talking about the preventive programs that we have at the Petaluma Health Center. And at the end, I'm going to be talking a little bit about a program that's really dear to my heart, which is a program called Petaluma Loves Active Youth, or PLAY, which is a pediatric wellness program that I started 4 years ago, and I have a video to show about it too. So 3, 4, 50. Has anybody ever heard of this model before when I'm talking about chronic disease? So 3, 4, 50 stands for 3 behaviors that are responsible for 4 chronic diseases that literally kill 1 in 2 people every single day. Probably not a surprise to most of you guys that the 3 behaviors are poor nutrition, lack of physical activity, and tobacco use. And these 4 diseases are heart disease, lung disease, type 2 diabetes, and cancer. And again, 1 in 2 people are killed every single day because of these diseases. And what these diseases have in common is that they are preventable, right? Very different than healthcare 100 years ago when when infectious disease was the main issue, where we were reacting, right? We would prescribe medications and we would give immunizations, or immunizations, I guess, are kind of preventive too. But now we are in a place where we really are capable of preventing problems in our healthcare system. So what we know is that chronic diseases have incredible impact on the individual as well as the healthcare system. So we know that for individuals, in fact, chronic diseases really affect people and their quality of life, right? People who live with chronic diseases tend to obviously it shortens their lives because they have organ failure a lot of times, but the quality of life isn't as great. They're a lot of times reliant on taking medications. Their energy level is lower. They aren't as productive at work because they can't sustain. I know that sounds kind of harsh, the burden for caregivers. Doesn't mean to sound like they're a burden, but it is true. I mean, children caring for their parents or even healthcare providers, it's very complicated when somebody has multiple chronic diseases and you're trying to manage, interactions between medications and such. So, and we also know that 75% of health costs, care costs, are due to chronic disease, which is an incredible number. And ultimately, like I was saying before, the people that have chronic illnesses tend to be not as productive in the workplace, calling out to be sick and so forth. So definitely a huge impact on the individual as well as the system at large. So is everybody familiar with community health centers? Yeah, not so much. So community health centers are typically nonprofits. They usually, there's one in every county. The Petaluma Health Center is an example of a community health center. They, typically it's they offer, the people that they serve are underinsured or insured, or uninsured, underinsured, or have some sort of, they also is open to people who have private insurance too, and there's a sliding scale. So a lot of low income folks go there, but it's also open to people who have private insurance too. So anyhow, community health centers are great models for sustainable health care. We know that for every dollar invested up front, there are $2 in savings for the overall healthcare system. Why that is there's a lot of focus on preventive care from the provider and some of the wellness programs that are offered. Typically those that come to, people avoid going to the emergency room and come to community health centers instead. And that's, we kind of promote that in our practice and our goal. That's part of our goals. And we also know it's much more affordable for patients. There was a report recently that came out that said people that come to community health centers tend to save up to $1,400 per year per person. So it's pretty significant. So the Petaluma Health Center serves up to, I think, about 18,000 people each year. We're a pretty big facility. We have over 25 medical providers. And 2 years ago, we moved to a much larger facility that now is happy to have what we call the Center for Good Health, and where we promote a lot of wellness services. So probably the largest component of our wellness program are these shared medical visits, probably more commonly known as group visits. I know Kaiser, for example, offers these as well, and they have been proven to be actually really productive and really meaningful for the patients, but also really economical for the health center too, because if you think about it, people come for an hour and you're billing a whole lot of people for just 1 hour. But what's definitely known is that people really do well when they work together in a group setting. So they come in, for example, one of our group visits is a group called Taking Control of Your Health. So the medical provider will refer them to this group if they have a chronic disease, such as the ones we talked about before. And as a group, they will learn about the physiology of this illness and treatment modalities, and they'll learn from each other. And it's been proven to be really an effective model for treatment. We also offer, as part of our wellness program, we offer acupuncture visits. We have up to, I think, 100 visits per week. And we have a couple doctors that do integrative health one-on-one visits, where he talks about other approaches for treatment, such as, Eastern modalities and such, not just allopathic treatments. We have a really great community fitness classes program where we offer literally fitness classes to patients and also people in the community for really affordable prices. We have peer-led support groups. We have an LGBTQ group, which is, I'm sure you guys are familiar with that. I don't even know if I can go through the acronym, but which is really successful. And we have a smoking cessation peer-led group. We have a great staff wellness group where we offer massage and CSA box deliveries, and we collaborate with multiple community organizations. And I'm really happy to say that we have this awesome vegetable and herb garden that we put in a couple of years ago, and it's open to patients and staff. So there is optimism for the future if we are able to really promote these wellness and preventive practices. I don't think I really need to go through each bullet point, but the fact is that we can really lower individual as well as taxpayer burden if we're able to really implement these programs and get more people to focus on prevention and not so much reactive medicine. And I think I'm kind of talking to the choir, preaching to the choir here, but we all know people who are probably doing more reactionary versus preventive medicine. So work as a community. So I'll just take the next couple minutes to review this Petaluma Loves Active Youth. So when I first started working at the Petaluma Health Center 4 years ago, it didn't take much for me to want to develop this program when I heard that 1 in 3 of our pediatric or our child patients were overweight or obese. And that is equivalent with the national average. And I just heard like 2 days ago actually that our population is it's increased to I think like 40% now. So it's too high, and we know that if kids are overweight and obese, then they're going to be developing these chronic illnesses before they're even over 18 years old. So we really got to make a difference when they're young. So Play is a really fun program. We work with the children and their parents to develop healthy practices through nutrition and exercise education. We have an actual physical component to the program where they're getting up and moving and dancing and doing fun stuff. We collaborate. We have a nutritionist that's part of it, and she comes in and does a cooking demonstration. And the goal, again, is to really to get these kids engaged in healthy nutrition and well-being to prevent chronic disease. As I mentioned, we have many collaborations within the Petaluma Health Center, and we're lucky to collaborate with an incredible organic farm in Petaluma called Petaluma Bounty. Their mission is very similar to ours in that we try to provide wellness to low-income folks. So we started collaborating with them 4 years ago, and we've gotten funding the last 2 years through a grant to provide families with weekly CSA boxes. And it's a wonderful way to hopefully get these families to not only learn the importance of healthy nutrition, but to go home and actually prepare healthy meals. Speaking of sustainability, grants sometimes aren't all that sustainable, right? You have to keep reapplying for them. So this year we're actually changing our fundraising to a campaign. We're reaching out to the community to try to get organizations to sponsor a box, and individuals too. And I have, I'm actually going to show a video, and the video is kind of a promotional video. But if anybody is interested in or knows anybody that's works for an organization that may be interested in sponsoring a box, we're just now promoting this campaign. So I'm going to go ahead and show the video, and if anybody has any questions at the end, I'm happy to answer them. And thank you for bearing with me.
My name is Kyla Ehrenreich, and I'm a physician assistant here at the Petaluma Health Center. The Petaluma Health Center is a federally qualified health center that serves a population that is typically low income and underserved. 1 in 3 of our pediatric patients here at the Petaluma Health Center are considered overweight or obese, which is basically equivalent with the national average. These are some kids that are they're at serious risk for developing chronic illnesses like diabetes and high blood pressure and high cholesterol and all of these very preventable chronic illnesses. So Play, which stands for Petaluma Loves Active Youth, is a wellness group that we offer here at the Petaluma Health Center. Play is fun. We like to have fun and play.
Petaluma Bounty's mission is healthy food for everyone. It provides a place for all community members to come and grow food in community for community. It provides a place for people to learn how their food is grown and to reconnect with their food source. Petaluma Bounty is really excited to be part of this collaboration with Petaluma Health Center.
The families that are in the program receive a gorgeous box of local organic vegetables from the Petaluma Bounty farm. And with these vegetables, we do a cooking demonstration. And interestingly, parents will tell me they would have never eaten that at home, but when they see it being prepared, they see where their food's coming from, they're ready to eat it.
The Bounty's role in this is that we provide the healthy produce, and we also invite the families to come out to get to know the farmer that's growing the food for them, and to participate, to literally get their hands dirty, so that they can start to change their relationship to their food and start to pay more attention to what it is they're putting in their bodies.
In play, we talked about the different parts of a plant. There are roots, and then there's the stem, the leaves, the flowers, the seeds. And we talked about all the different kinds of vegetables we eat from each part of the plant. And after that, we brought them out into the garden and had a scavenger hunt where we looked around the garden for leaves that were bigger than your head, or peppermint, so kids were smelling the plants, they were touching them and really looking at them. Do you guys know what this stuff is? No. And then afterwards, we gave them their bags from the Petaluma Bounty farm, and the kids were so excited about them. This 6-year-old boy reached into the bag and he pulled out this beech, but still had the leaves attached, like it had just come out of the ground. And he was shouting like, "Look, Mom, it's a root." And that to me, it shows that it's getting to them. When kids see where the plant comes from and how it's grown, and they plant the seeds themselves, they're so much more likely to eat it. They know that it's good for them.
Guys, all these bags are full of little vegetables. You made that? Can you tell me why you need to eat vegetables?
Because to be healthy. So you can stay healthy.
Nice. What's your favorite vegetable?
Carrots.
The biggest change I see in kids is their willingness to try new food, and their willingness to try vegetables.
Who wants to try it again?
I do.
And in these boxes come a variety of foods that maybe they've never seen, maybe they've never smelled, maybe they've never tasted, but they're willing to try it. And that's really what we're trying to hammer in, is just enjoying vegetables and enjoying different kinds of foods.
We're trying to make locally grown food available to everyone, and with your help, we can do it. Donate today to the Sponsor Box program
To help a child eat well,
to make a difference in these children's lives,
and to prevent a child from developing a chronic illness.
to provide healthy food for